Well, that's a good question. It sort of almost implies that I had thought about a pathway. Certainly hadn't. I started, as most people know, as a registered nurse, and I started training to be a registered nurse. It'll be 38 years at the start of next year, so quite a long time ago. And from there, I went to Broken Hill for 10 years and worked out there. And I think during that time, I got to do some things that, really probably without realising it, gave me some skills for the future. I guess, negotiating, dealing with difficult situations, because I wrote the first 4 submissions for nurse practitioners in New South Wales in 1999, which was 4 remote communities in the far west, Ivanhoe, Wilcannia, Tibooburra and Winaring. And so that was a very interesting experience for me. And at the same time, I was quite heavily involved with the Nurses Association, and I was interested in advocacy and I guess just the principles of people standing together to improve their workplaces, but also probably around, individual matters where people were perhaps, facing some difficulties for whatever reason. And I actually left the Far West and went straight to work at the Nurses Association. So I was employed there for about 8.5 years. And I think, that was probably a divergence from what one might think about, as the normal pathway, particularly given where I ended up. But again, in that role, it was very instrumental for me, I think. Again, that advocacy issue, working through very difficult problems, talking to large groups of unhappy people at times, and negotiating and mediating and working your way through problems. And I think those skills were critical to sort of what happened next, because I left there and I was the workforce director for Northern Sydney and Central Coast Area Health Service, followed by the districts were formed to Director of Operations for Northern Sydney, LHD, and then the Chief Nursing Midwifery Officer. That sort of all, I suppose, in retrospect, happened in sort of fairly rapid succession, mainly because of circumstance with the district formation and then Chief Nursing Midwifery Officer role coming up at a time that was good for me. And I was in that job, and then I was asked to sort of lead some work around some ambulance issues in 2015. And I think that was one of the things that substantially led to the then Secretary, Mary Foley, sort of probably seeing something in me that had I not been pulled out to do that work, I don't think I would have been in that consideration at all, the deputy role. But I became a deputy secretary for system performance at the end of 2015, and I was in that role for 6.5 years. And of course, during the pandemic, as the controller for the State Health Emergency Operations Centre, largely because that related to the position that I had. And then when the secretary role came up, I guess I felt that given all of that, I was probably ready to do that, but pragmatic about the fact that, the government may have gone another way, but that's how I ended up here. So, yeah, nothing deliberate about any of it, really, is probably the summation of that. Definitely were. The first and most significant person in my working life was my first nursing unit manager in Broken Hill, and her name is Linda Lynett. And we often laugh about, it's just at various points of my career, she's, I've reached out to her to just sort of say, this has happened or that's happened. And the reason I raise her is because I think at a young age, she recognised probably something in me that whilst I was relatively confident in my own self, she really pushed me to apply for things. And, having someone, because I revered her, incredibly smart woman. So to have someone like her that was encouraging me meant a lot. And subsequent to that, I think I've been really fortunate over many of the roles, not all of them. There are some where I've learnt lessons about what not to do from the people that I've worked with. But, for the most part, the people I've worked with, many of them are women. Obviously, Karen Crawshaw, who was my boss when I was a chief nurse, Mary Foley, who recognised something in me at that time. And then obviously I worked very closely with Elizabeth Cobb. I've not been held back by the people around me, and that makes a lot of difference to you because I'm not an overly ambitious person. I just work really hard and try to do my best, and I think that's been recognised by those people. There have been a few blokes as well, no doubt, but definitely the women have been a very strong feature in my life. Yeah, look, I think that's a really interesting question for women in particular in senior leadership roles. Look, I say women because women do often assume the carer role in many families. So in my case, I've got two kids and they're grown up now, but my husband absolutely was the one who would take leave when the school holidays were on. I often wasn't able to do that. I think between the two of us and our son, because he's a bit older than his sister, so he was sort of able to help out a bit as well. It really has been critically important to me. I think to myself a lot, and I often, much to my family's horror, but although mostly they don't know about it, but I'll often show a photo of them, including my son-in-law now, various things that I'm at to make the point that they're the thing that are the most obviously mean the most to me. Because the most often question I get in this job is, how do you deal with the stress? And, response to that is sometimes not very well. But fundamentally, my family are, if anything happened to any of them, it would be far worse than anything that could happen to me at work. And I think trying to keep that perspective is really important. I'm very fortunate to have had a harmonious home life. Not to say, like any family, we don't have our issues, but it is a thing that allows me to do what I do. And I'm, my husband in particular, I think I'm very grateful to him and the sort of sacrifices that he's made in his own career that have helped me to be more successful in mine. You'd be a liar if you said you hadn't had moments of doubt. There's certainly moments of resistance. I mean, that all of those things, I think for any leader are things. If you don't have doubt at times about yourself, I think you're probably not reflecting on your own conduct and behaviour and leadership. And I think there's doubt and then there's doubt. And I suppose one of the things, and I was only talking to a leadership group about this the other day, you have to be decisive in leadership roles, in my view. I think people look to you for decision making, having taken all the factors into account. If you spend too much time doubting yourself in that realm, it's very difficult for the people around you and it's difficult for yourself. So you've got to back yourself. But of course I doubt things and, wonder about things and, worry and think about how I can navigate through things, around things. And, again, another very important person in my life is a former chief executive of New South Wales Health, Heather Gray, who was around for a long time and did lots of different leadership roles. So she, unfortunately for her in her retirement, is my go-to person when I'm struggling with a decision or I'm doubting myself or I'm worrying, because it helps to level me, think back, sit back and perhaps, take a different path to what my initial instinct would be. Are there unspoken rules? Well, look, I don't know. I suppose I don't really probably think about it in that way, about unspoken rules. I think you have to understand the environment you're working in. Obviously, we work, for the government of the day. That's very important to understand that context, the role the ministry plays as the bureaucracy to a state government versus the system manager to a state health system. And I think, working your way through that can be quite challenging at times. Look, I think I'm human. All of those things impact me, but I think I've got, strong, good intuition around myself, and they're infrequent moments, I would say, rather than frequent. I think having been in a senior leadership role here for a number of years before I became a secretary was useful, because you get used to, as I said, working with the government of the day, working with government ministers, premiers, treasurers, whatever. And so I think that is an underestimated element of these roles that we have here, because health people, and obviously I am a health person, come in here and think, oh, it'll be just the same as working out in the districts, but it'll, slightly different perspective. No, totally different. And you've got to understand that. So it wasn't really a surprise to me when I became a secretary, but I guess it ratchets up a notch because, you're it. The bigger surprise, though, is more because I'm very, probably sometimes I think I've got to make sure I keep, looking outside of the New South Wales health system, and I'm very invested in looking into it. And, when I was at this, I was at I think it was a women's, International Women's Day breakfast. It was right after I became the secretary, and I put one of these photos up of my husband, my son, his now husband, and our daughter. So the reason I put the photo up was exactly what I said to you before. It was, to respond to that inevitable question of how do you manage the stress of these types of jobs? New South Wales health is massive. It's complex. So much goes right. And unfortunately, sometimes things don't. And managing all of that is incredibly stressful. And, it's a heavy weight of responsibility, which I respect and understand. And at the end of the breakfast, a woman came up to me and she said, "Thank you very much for sharing that photo of your family." Her perspective on that was, my son's gay. He wasn't married at the time to Jake, but he is now. And so I did not put that photo up for that reason. But for that person, the perspective was, here's the health secretary, telling this audience that, she has a gay son. I mean, to me, it doesn't even rate a sort of a second thought in my mind. And yeah, so I that was one thing that was somewhat surprising to me, and I guess a learning experience for me that I share with others is people will watch you and they will interpret things from what you do and say in ways you don't expect. So that was a really interesting lesson for me. And obviously, I'm glad that people know that I have, that sort of inclusivity in my person, because it's really important to me that people that come to work every day, all 180,000 of them across New South Wales Health, know that, this is an inclusive workplace. First of all, there have probably been, people over the years, fair enough too, that have aspired to be the health secretary and haven't, it hasn't happened. And I wasn't one of those people, but it is a role that is a very, very significantly about timing in terms of where you're at and where the system's at and where the government of the day is at, and you have to be pragmatic about it. So it's not to say that people shouldn't work towards it if that's their ambition, absolutely, but there is a degree of pragmatism required, because, ultimately, what is it about someone who ends up in a senior leadership role, whether it's this one or another one, that sets them apart from others at a point in time? And it is, in my view, technical professional skill and knowledge, and I do have a lot of technical professional skill and knowledge after all of the different jobs I've done. I studied law while I was a deputy secretary and managed to finish that, but I did enjoy it, and it's sort of just sitting there, I guess, in case I ever need it. But professional skill and knowledge will only get you so far. And I think then there's other features of leadership that are going to come to the fore. So your ability to connect with people, your ability to get your messages heard, notwithstanding what I've just said about how difficult that can be sometimes. Knowing when to choosing your battles carefully, because it's very easy to win the battle and lose the war. And I think that, if you don't, which is why all of us should take a sit back at times and think, okay, I've got a red mist at the moment. Should I react to that? Probably not. Just, cool it and think through what the consequences of your actions are going to be, not just in the moment, but down the track. And I think that, working in these roles, and particularly obviously with other very senior people in other government agencies or in this agency, but also with politicians, you've really got to find that way of developing trust and confidence and being true to your word. And if you deviate away from that, trust is hard earned and very easily lost. So I think, being acutely aware of that's important. So from my perspective, in terms of not that, necessarily or clearly the person who comes next in this role will be up to me, but I would like to think that I've got an eye to the talent around me, and I can see in people some of those qualities in addition to their expertise as a health professional or a government professional. Sort of the soft skills that I think we really don't put enough emphasis and focus on. And it's really important, I think, that we do. Yes, look, we're working on the a sort of CE pipeline, if you like, and I think that we probably, again, it's something that at a health system level over the years has probably been a bit more ad hoc. I think our districts and networks have certainly, many of them are very, very clearly working towards succession planning with their boards, and so on, and it's really important that they do it. And of course, the ministry has an important role in that as well, because often it will be this place that thinks, okay, I know that person's over there, maybe they'll, go and fill this position over here. So I think there's that, having that framework and having that deliberate intention to be able to recognise people in our system is very important, and not just leaving it to a ad hoc sort of, oh, well, we'll find somebody type of attitude, because that's clearly no good. The other piece of advice, I guess, goes back to my previous comments. There's nothing like experience in terms of learning about how to navigate your way through these roles, because they're not easy. And, they're not easy, but they're also roles with great privilege, in the sense that you are leading, very large organisations to deliver care to the community that we serve, which we always have to come back to. So what are the sorts of skills we want these people to have in the future? And technical professional skill and knowledge will only get you so far. It's that sort of old adage of, you hire for skill and fire for behaviour, and 9.9 times out of 10 that is true. So behaviours and ways of working and leading with heart and kindness and compassion is important, should not be read as weakness. I think that's been well quoted. I think Jacinda Ardern or someone, don't mistake my kindness for weakness. Being nice is not the answer either. Being nice and trying to make nice decisions to make everybody feel nice doesn't work. You can make hard decisions, so by being kind about how you go about it. And so I think, from my perspective, boards and our own team here are looking for succession planning, and for the leaders of the future really need to think about what the characteristics of our leaders are. Someone said to me, did you set out to be the health secretary? I'm like, goodness me, absolutely not. I mean, I wouldn't have even known what the health DG or secretary was when I was, first started work. I wouldn't even have, been in my orbit, sort of thing. But I think that, probably just to back yourself, I have sort of always done that anyway. It's been something, I think, a feature of my career has been, I've been offered opportunities along the way. Almost every role I've had has sort of been someone saying, hey, I think you should think about doing this. And I had the courage to say, yeah, I think I can give that a fair go. And so I think backing yourself, believing in yourself, also though being pragmatic, and it's something that's coming to me as I get older, and also, I guess, more experienced and seeing different parts of the world. I think as a female leader, one of the things, yes, we break through, and I think, New South Wales Health, for example, has got a long and proud history of female leadership. You go back, Robin Kruk, Deborah Piccone, Mary Foley, Elizabeth Cough, and now me. So over the span of, a number of years now, there's been a female leader at the head of New South Wales Health. But you still feel that you're fighting against something. And you can't assume that because you end up in a role like this, that will stop. And so, for me, I probably don't think about it as a fight necessarily, but there's that issue of, is my voice being heard in the same way that a male voice in my position would be heard? Do I get mansplained? Yes, I do. I still find that when it happens, like, it's just gobsmacking when you sort of can't unsee it when you start to pay attention to it. And I think that, as I've said to others, in reflecting on Broken Hill, which I love as a place, and, my son was born there, it's a very important part of my life. And I wasn't living there at the time, but, it was 1981 in Broken Hill before married women, unless so nurses or teachers were allowed to work after they got married. Now, we're talking about a matter of 44 years ago, and we wonder why we're still pushing so hard up against perceptions and bias that sits in people's minds that they don't even realise. And so, I think that's a really interesting perspective, and something that it creates a degree of frustration in you, because you think, what do I have to do? I have recommended in the past that, the tip for people to listen to Taylor Swift's If I Was a Man song, because it's quite insightful. The other thing I would really, really tell myself is to always be yourself. I always have been. And, someone said to me once when I'd started to progress in my career, don't change who you are because you think that you've got to do that to get on. And that is so true. So I think for the most part, people can see that I'm straightforward. I am authentic and genuine. I don't play games. I just get on with it and have the conversations with people that I need to have, but also approach the role that I've got with kindness and compassion, because I think at the end of the day, that's a big thing for me to be able to offer to the people that are around me doing really hard jobs. With the things that are going on in the world at the moment, I think as the head of a very, very, very large organisation, the biggest public sector organisation in the country, there is no better time for us to stand up for those principles. And, while ever I'm here, I'll continue to do that.